Welcome back in. If you're just tuning in, you're watching Living Smart in the Lowcountry. We're learning about what they do here at St. Joseph's Candlers, and we're here in the Hyperbaric chamber room. It's a mouthful and well-deserved because it does a lot. It's a really important piece of machinery. Dr. Hussong is joining us again to talk us through the science behind this. Thanks so much.
Thank you again.
Yeah, so let's talk about oxygen therapy just as a general term. What does that mean? What does it do?
A hyperbaric oxygen chamber is an enclosed chamber. The patient goes in the chamber, the entire patient, and they are submersed in 100% oxygen. It's called hyperbaric because it's above normal atmospheric pressure. Right now, you and I are sitting in a room, and we have what we call 1 atmosphere of pressure on our bodies. In the chamber, we go up to 2 atmospheres. And when you put the oxygen under increased pressure, it increases the amount of oxygen you can get dissolved in the bloodstream.
Okay, so some really important technology and science behind it. So it's really helping to increase blood flow, oxygen in the blood. And how does that play a role specifically when you're talking about some of the treatment plans that you're asking people to undergo here?
Well, again, by increasing the amount of oxygen, we don't increase the amount of oxygen carried by the red blood cells, but we increase the amount of oxygen that gets dissolved into the blood itself or the bloodstream. In that way, the oxygen, when it gets to the difficult to heal wounds that usually are a little bit what we call hypoxic, meaning not getting a lot of oxygen or necessarily blood flow, the oxygen can diffuse out further than what's in the normal blood carrying system. And that helps promote new blood vessel growth, helps kill bacteria, helps promote healing in general.
Okay. So one of the things that I've learned here is oftentimes when people are seeking treatment here or seeking care here, this isn't their first stop.
Correct.
So they have definitely been under some other treatment plans or seen some other physicians, and then they're coming here for this particular plan. So what is it that puts a person in a place that this would be a good step for them?
There are 2 different kinds of hyperbaric oxygen therapy, what we call on-label and off-label. In a facility like this, we do on-label, which means that we do the several criteria, there are like 13 of them, that are approved by Medicare. Now, we don't do all of those because we are an outpatient wound care facility, but primarily we do diabetic ulcerations, foot ulcers. They have to be a certain what we call Wagner grade or score and have to be present for a certain amount of time. And hyperbaric oxygen has been shown to be beneficial for those patients, reducing or increasing cure rates from perhaps maybe 56% to about 75%. We also have wounds with what we call osteomyelitis or infection in the bone. The hyperbaric oxygen is helpful for those patients if they've not improved with traditional antibiotic therapy in 4 to 6 weeks. And then we also treat patients with radiation injury. Most commonly we may see patients, male patients have had radiation for prostate cancer. They can get inflammation of the rectum or the bladder and with some bleeding, and they respond to hyperbaric oxygen therapy. The other you may see is a breast cancer patient, maybe post-surgery with post-radiation and difficult to heal wounds. We can treat those patients with hyperbaric oxygen therapy.
Wow, that's an incredible list of things that you're able to utilize the machines for. You know, with all of those different things that you mentioned, I'm sure a lot of questions come up, and we have about a minute before we go to break. What are some of the most common questions or misconceptions that you get?
Probably one is that we can treat everything with hyperbaric oxygen. And again, as I said, we do on-label, which means we're limited to certain diagnoses. And we do have to go through some hurdles of documentation, research, to get people qualified. We also have to, once we start therapy, we have to reassess. And if we're not seeing improvements, then we're obligated to discontinue therapy. Fortunately, we see improvements with most everyone doing the therapy.
Wow, really impressive technology and a lot of great things that you're able to do here. For our viewers who are watching, who are wondering a little bit more about how it works, how it feels, what you need to do to prepare, we're going to bring a patient in and answer some of those questions. Perfect. Thank you so much, Dr. Hussong, for your time.
Thank you.
We appreciate it. All right, we have more. We'll be back after this break, and we hope you'll stick around.